Bismillahirrahmanirrahim. Assalamu alaikum. A 58-year-old man comes to the urgent care center with 2 week history of an ulcer on his right foot. He recalled no injury and found a dam-sized ulcer on the bottom of the foot after noticing soakage on his socks. The patient has been cleaning the wound with antiseptic and applying topical antibiotic, and it has failed to heal. He has had no pain surrounding redness, fever, or chill. The patient was diagnosed with hypertension several years ago but had no follow-up with a physician. He takes ibuprofen for occasional back pain. The patient has a 30-pack-year smoking history and drinks 1 or 2 beers daily. He works in a warehouse where he is constantly on the move and considers himself in a good health. Temperature is 36, blood pressure is 156/98, pulse is 88 per minute. BMI is 32 kg. On examination, the feet are warm and dry. A 2 centimeter non-tender ulcer is present on the sole of the foot, just below the head of the first metatarsal bone. There is a scant discharge and necrotic tissue at the ulcer bed, but the bone probe is negative. Which of the following is most likely diagnosis? The underlying cause of this patient foot ulcer. So this is the foot ulcer in the image below. So what is the management option for this patient? And first of all, this is a 58-year-old man having 2 weeks of an ulcer on his right foot. He recalled no injury and found a dam-sized ulcer on the bottom of the foot. The ulcer failed to heal with daily antiseptic and applying topical antibiotic. He has had no pain surrounding redness, fever, or chill. The patient is obese and hypertensive. On examination, the feet are warm and dry, and a 2 centimeter non-tender ulcer and a necrotic tissue at the ulcer bed, but the bone probe is negative. So based on these hints, what is the diagnosis of this question? The diagnosis of this question is neuropathic ulcer, related to diabetes. And for the investigation, here the correct option is choice D, hemoglobin HbA1c. So here the correct option is HbA1c. So here the correct option is choice D, hemoglobin HbA1c. So this patient having neuropathic ulcer that are caused by repeated pressure, friction, or trauma due to lack of sensation and the local tissue. They typically occur at weight-bearing side on the sole of the foot. Diabetes mellitus is the most common cause of neuropathic ulcer, and for the diagnosis of underlying foot ulcer, this patient having the hemoglobin 1A assay can be measured to look for diabetes, or fasting glucose should be measured. Come to the incorrect one. Ankle brachial index measurement is for the peripheral arterial diseases. Choice B, culture from the ulcer bed. So culture from an ulcer bed typically find polymicrobial colonization but does not indicate true infection in the absence of fever, erythema, purulent discharge. Choice C, Doppler venous ultrasonography. So Doppler ultrasonography can identify venous insufficiency or obstruction. Choice E, MRI of the lumbosacral spine. So MRI of the spine is used for evaluation of the lumbosacral radiculopathy, which typically present with pain in the low back that radiate to the foot. Choice F, vasculitis serologic markers. So vasculitis ulcers are typically painful and are usually associated with additional skin features such as non-blanching petechiae or purpura. Thank you.